Hello, guys. Welcome to the part two of the MRCEM primary buzzwords. These buzzwords are going to help you get the right score in the exam. And let's start with the slides. Before I go further ahead, this is a quote which I loved very much, and I stole it from one of the Facebook posts. Half of what you learn in medical school will be shown to be wrong or out of date within 5 years of your graduation. The trouble is, no one can tell you which half, so the most important thing to learn is how to learn on your own. Let's see what we have in store for today. Nerve supply of the foot first web space between the great toe and the second toe is the deep peroneal nerve or the deep fibular nerve, which is L4 and L5. This is a very high yield topic, and this is likely to show up on the exams. Mechanism of action of ondansetron. We use ondansetron quite a lot in the emergency department. We need to know the mechanism. It is a 5-HT3 inhibitor, which is anti-serotonin. So 5-HT3 inhibitor. Hemorrhagic shock stages. We need to know the 4 stages of hemorrhagic shock. Stage 1, 2, 3 and 4. One is less than 15% of blood loss. Stage 2 is 15 to 30% of blood loss. Stage 3 is 30 to 40% of blood loss. And stage 4 is more than 40% of blood loss. Heart rate is normal in the first stage, and between 100 to 120 in the second, 120 to 140 in the third, and greater than 140 in the fourth. The blood pressure remains normal in stage 1 and 2, but is decreased in stage 3 and 4. They can show up a question and asking you in which stage of shock or how much of blood loss does this patient have. This is very important even in your practical life. Right shift of oxygen dissociation curve. So the hemoglobin oxygen dissociation curve moves to the right when there is cadet. So cadet sees to the right, carbon dioxide, acidosis, 2,3-DPG, exercise and temperature. Your oxygen hemoglobin dissociation curve moves to the right. C-reactive protein. C-reactive protein is a very common test we do at work. C-reactive protein is synthesized in the liver in response to IL-6, and the function is opsonization of bacteria. Meningitis in newborn. The organisms responsible here are different. Meningitis in newborn is gel, group B streptococcus, which is strep A galactiae, E. coli and Listeria monocytogenes. This is very high yield, especially when you're seeing newborns in your emergency department and you suspect meningitis. You need to cover for group B strep, E. coli and Listeria monocytogenes. Puzzle's law is definitely going to be there on your exam. It states that the flow of fluid is directly proportional to radius raised to 4. So if you increase the size of cannula gauge just slightly, the flow will be like 4 times increased. Cardiac output is simple: stroke volume into heart rate. Cardiac output is stroke volume times heart rate. Mean arterial pressure, systolic blood pressure plus twice diastolic pressure, the whole in bracket divided by 3. They can fidget around with this particular formula, but this is the easiest to remember, and then you can calculate accordingly. Mechanism of action of ketamine. It is an NMDA antagonist. Mechanism of action of flecainide. It is a class 1C drug, and it is a sodium channel blocker. Adrenaline in CPR. The dose is 1 milligram, 1:10,000 every 3 to 5 minutes. In shockable rhythm, it is given immediately after the third shock. Amiodarone in CPR, it is used only in shockable rhythm. The dose is 300 milligram after the third shock, 150 milligram after the fifth shock. Amiodarone side effects, you need to know this. You need to know them very thoroughly. You need to check the liver function test thyroid function test, and pulmonary function test. So the side effects are pulmonary fibrosis, liver toxicity, hyperthyroidism. The other thing I would like to add over here is corneal deposits, which is irreversible. As soon as you stop the drug, it goes away. So it is reversible. Corneal deposits are reversible. Lithium, the side effect is nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus is lithium. Paracetamol, toxic metabolite. They might ask you what is the toxic metabolite on paracetamol overdose, and that is NAPQI, NAPQI. NAPQI is the toxic metabolite, and the antidote for paracetamol overdose is N-acetylcysteine. Locations of glycolysis, Krebs cycle, and oxidative phosphorylation in the cell. Glycolysis happens in the cytoplasm. Krebs cycle happens in the mitochondrial matrix. Apologies for the typo there. Oxidative phosphorylation happens in the inner mitochondrial membrane. Metoclopramide side effects. Yes, this can come in the exam as well. It causes acute dystonia, or we call it oculogyric crisis. PPIs act on what cells? PPIs act on the parietal cells. Parietal cells, so I would remember it as PPPIs, parietal proton pump inhibitors. PPIs, what vitamin deficiency can result if you take PPIs for long term? What vitamin deficiency can result? What mineral deficiency can result? And if you take PPIs on long term, you will get B12 deficiency, and in terms of minerals, magnesium and iron deficiency. Magnesium is quite important because low magnesium levels can lead to confusional state and seizures. That's all for today. Thank you so much for watching this video. If you like this video series, please write in the comment below. Please give it a thumbs up. Share the video with your colleagues. I hope you do well in your examinations and you do well in the wards for your patients. Happy reading, happy studying, and peace.